other.
Remove all the thoughts that keep us apart. I wish you could know what it means to be me. When you see and agree that we should be free, I wish I could give all
Welcome, friends.
I wish I like I'm lost.
Welcome, everyone. Drop your name in the chat. Say hello. Tell us where you're from.
I could be sweet.
You know, I think maybe we can fade out the music and just welcome folks on in. Hello, everyone. Go ahead and please drop your name. Where are you from, folks? Battle Creek, Michigan. Fabulous. Welcome. Come on in. Where are other folks from? One Love Midwifery, Long Island. Yay. Thanks for being here. Who else is out there? So we got the Midwest, we got the East Coast. Who else we got? Let's see. Oh, Charlotte, North Carolina. Yay. Welcome, everyone. We're just going to hang out here for a minute and let other folks join. And si alguien, si necesita interpretación en español, solamente debe buscar el botón. ¿Dónde está? ¿El botón? No veo el botón, pero ¿dónde se el botón? Bueno, hay un botón, un globo en el barra del menú para seleccionar su preferencia de idioma. Y puede poner en español. En tu móvil, haga clic en la opción de tus cuentas, puede ser más. So, se necesita interpretación, tenemos interpretación de María García. Wonderful. Okay, we'll give just a couple more minutes here. See if other friends are joining us. Drop your name in the chat if you want to let us know where you're calling in from. National Black Midwives Alliance, Atlanta, Georgia. Thank you so much for being here. Thank you for all your work. We love the Alliance. We have all our friends here today. Y otra vez, si necesitas interpretación en español, haga clic en el globito en la barra abajo o en su móvil, haga clic en la opción de tus puntos lecciones. Interpretation today from good friend Maria. All right. Well, I'm sure some other folks are going to be joining us, but I think we can dive on in. Why don't we go ahead and we can just see all the panelists and we can take down the interpretation slide and just bring all the panelists into the space. Let's see. Oh, there's a folks here, Northern Minnesota. I happen to be located at this very moment in Minnesota. I do not live here. Joe, whenever you have a moment, if you could just take down the slides and we'll go ahead and look at all the panelists. There we go. All right, we've got a crew. Welcome everyone to day number 3 of Birth Center Week 2024. We're so excited that you're here. It's going to be a great session. My name's Julie Quiroz. I'm part of the Birth Center Equity team, and Birth Center Week is one of my primary joys and responsibilities in life. And we're just so glad you're here. For those who, so this session, as we know, is Step Up Together, collaborating to center safety in community birth. It's going to be a really great in-depth session for folks. I wanted to start, I'm gonna pass it over to our amazing team of panelists. Before we do that, I wanted to just welcome everyone to Birth Center Week. This is the second year that we've had the honor of hosting Birth Center Week. And Birth Center Week is really about celebrating the power and potential of birth centers, of all birth centers, particularly community birth centers. It's also about growing the economic, political, and cultural power of birth centers led by Black, Indigenous people of color. And Birth Center Equity, we have been the host of Birth Center Week. And we exist, our purpose is to make sure that every community everywhere has access to safe and loving care for generations to come. And our heart and soul is our network of over 40 birth centers across the country, including Puerto Rico, that are led by Black, Indigenous people of color. So that's who we are. And before we go into the session, wanted to invite people to just bring your whole self to this space. I know for most of us, you've already had a pretty full day. I'm sure your shoulders are already a little tight. Maybe your neck's feeling a little stiff. Just invite you to stretch in whatever way feels good to you. I'll do this one, maybe roll your shoulders, whatever you need to do, just to feel comfortable. And remember just to stay comfortable the whole time. And lastly, or centrally, Birth Center Equity, we hold 3 values at our core. And those values are safety, abundance, and liberation. And I really want to call those in collectively and personally for each of us. So I'd invite you, however you'd like to call those values in, but I'll invite you in this way if you'd like to join me. If you'd like to just maybe put your hands like this, not fists, not tight, but just like you're just holding, I don't know, a child's hand, maybe just your hands like this a little bit, you know, whatever you'd like. And maybe if you'd like to close your eyes, just imagine and remember the feelings of safety in your body. And as you remember those feelings of safety, just open your hands and just welcome those feelings of safety into your heart and into this space. I invite you to bring your hands together again. And just remember your feelings of abundance, moments when you felt the energy, the potential, the love, the community that is abundance. Just call that in. Remember how that feels. And you open your hands to welcome it into this space or into your heart. Remember, it's always there for us. And then one last one, liberation. Just close your hands like you're holding again a child's hand, someone you love. And just remember those sparks, those moments of liberation that we've had together, that we've had individually. Just remember how that feels, the energy of liberation, the joy of liberation. And then just open your hands and welcome that into this space, into this group, into your heart. Thank you. Okay, so and Jen has joined us. Perfect. So we're gonna get started. So today, please, if you have questions or thoughts, you can drop them in the chat. We'll also have some moments along the way where we're gonna ask a question, and the moments at the end where we'll ask a question. But please feel free to ask anything or share anything in the chat whenever you want. I'm going to turn it over now to Amy Romano from Primary Maternity Care, who's going to lead this session today.
Hi, Julie. This is Mario, the interpreter. The interpretation feature hasn't been activated. I think you're the host. So if you could get it started for us, no?
No, that would be, sorry, everyone. I don't, do you
If
see, one second.
if somebody makes me host just very, very temporarily, I'll send that host duty back to them and I can activate it myself if you want to do that. But it has to be the host.
Okay, that should be, are you able to see that, Joe?
I do not see that. That's
You
why I
do
was wondering
not
whether
see
you were the
that.
host or not. Right.
Oh, this is interesting. Thank you, everyone. We're human over here. Hang on one second. Okay, let me find you, Mario, and I will temporarily make you, can I make you a co-host? Will that work?
It has to be a host or
Okay,
you can
I'm gonna
activate
make,
it and then I'll
I'm
shoot it right
making
back
you the
or send it
host
right
right
back. There
now.
we go.
Okay, gracias a todo el mundo que necesita interpretación en español. En un momento vamos a ver el globito que pueden usar. Okay, language interpretation is available. Click here to get started. So now is when they click. Is this correct, Mario? Okay. Hay un botón. No veo dónde está el botón. Pero hay un botón abajo. Okay. Dice language interpretation available. Haga clic ahí. Okay. El botón abajo y solamente debe escoger español si necesito. Y en tu móvil también hay un puntitos que dicen más. Bueno, gracias a todos. Okay, now we'll get started. Thank you everyone for allowing us to make sure that we have this in Spanish for folks who need it. Okay, I'll take it away. Oops, are you sending me back to be host again now, Mario? Thank you. All right, thanks so much.
All
Okay,
right.
now we'll get started.
Yeah. I can take it from here. Thank you so much, Julie, for leading us through that kind of centering exercise and just for greeting us and welcoming us in. And thanks for taking the moment that we just did to make sure interpretation is working. My name is Amy Romano. I will be presenting with a bunch of colleagues today who you'll meet shortly on our topic, Step Up Together, collaborating to center safety and community birth. So really glad to have the group that's here today and hopefully others who will be listening as we continue to access the resources from the week. This session is sponsored by Primary Maternity Care, which is the organization that I founded. And just briefly about who we are here and exist. We're about 4.5 years old and work with a bunch of different clients around strengthening systems for patient engagement, quality improvement, value-based payment, and community-based care delivery. And so we're really proud to have a lot of community-based and BIPOC-led birth centers among our clients, as well as nonprofit organizations and industry groups and folks that are working really in the first level of care space, which is what we care about and get really passionate about at PMC. So thanks for letting us sponsor this today. I will briefly introduce myself and then let my colleague Jen say hi as well. And then we're going to introduce our panelists. So my name again is Amy Romano. I use she, her pronouns. I am a midwife by clinical training, but I have been, as I say, midwifing the system for many years. I have worked in a number of birth centers, both here and abroad, actually. And I led the development of the care model and quality programs for a multi-state network of birth centers that was integrated with different health systems. And today I work with a number of birth centers and we offer this program, Step Up Together, that Jen and I are gonna share a little bit more about. And so I will pass it over to Jen to say hi and share briefly about her background, and then we'll hear from our panelists.
Thanks, Amy, and thanks everyone for having us here today. I'm so excited to share what we've been working on and the great partnership that we've had with this amazing team over in Detroit. I'm Jen Johnson. I use she, her pronouns. I am a certified nurse midwife living and practicing in Philadelphia, Pennsylvania. I'm a full scope midwife and I'm still in clinical practice. And for the last 4 years, I've also been working with Amy at PMC, and we together have developed and nurtured our cohort of programs, family of programs, Step Up Together. And I'm really excited to share the latest and greatest of what that has become and how we've really enjoyed partnering with the folks over in Detroit. So, hi.
Thanks. Sorry for the premature advance, but I was pretty excited to hear our panelists. Unfortunately, Charlie Snow, who's been a total leader and visionary on this project, had a family commitment that came up unexpectedly today. So we're thinking of Charlie, but she was unable to join us. So Tatiana, why don't we start with you, and then you can just pass it to your colleagues as you introduce yourselves and just share a little bit about your background with respect to this initiative.
Awesome. Hello, everyone. My name is Tatiana Johnson. I'm at Henry Ford Hospital midwife. I am a full scope midwife. I currently practice with Henry Ford, both in clinic and in the hospital. I work closely with Birth Detroit and their midwifery team as well. I have been a midwife for going on 3 years now. And I learned about Step Up Together through Birth Detroit, and it's been a fantastic program thus far. So thank you guys for having me today.
Hello, everyone. My name is Angela Foster. I am birth center midwife with Birth Detroit. I'm the primary midwife with Birth Detroit. And I was part of the cohort collaborative with Step Up at representing Birth Detroit. So welcome. Thank you.
And hello, everyone. My name is Dr. Cheryl Bellamy. I am a perinatal clinical nurse specialist at Henry Ford Health in Detroit. And I trained as a midwife, so we have a lot of midwives on the call today, which is fantastic. I have been on the internal part of the hospital side, working with Birth Detroit on this wonderful project. And we are so thrilled about the guidance with the Step Up Together team. It's just been absolutely wonderful. So we're excited to share more information about our journey. Thank you.
Awesome. Thanks. All right, let's dig in. And before we do, we're going to breathe again, because unbeknownst to most of you, I poured a big old cup of coffee on my computer about 3 hours ago, and I've been running around. So I am going to inhale for 4 seconds, hold my breath for 7 seconds, and exhale for 8 seconds. Jen, you want to lead us through it so I can actually breathe and bring down my blood pressure? Thank you.
I would love to. I also have clinic brain. I just literally seconds before joining saw my last patient in the clinic today. So I forgot to say that I have been a midwife for 8 years and had practiced in the home birth center, multiple different birth centers, including the one where Amy helped to collaborate, the multi-state birth center network, as well as hospital practices. So I wanted to add that so that the folks who have never met me or worked with me before know where I'm coming from. So thank you for your generosity. And I would love to lead us all in this breathing exercise. So if everyone can just put your feet flat on the floor and stack up your spine in a way that feels good to you. If you have something in your hand and you want to release it, you may. If you want to drop your shoulders, feel free to do so. And right now you can breathe normally as I explain the breathing exercise. As Amy said, and it's on the screen, you'll breathe in for a certain amount of time, hold at the top, and then breathe out. Try to take a deep belly breath, like you feel your whole diaphragm expand on the inhale. And when you hold your breath, try to hold that energy inside your heart. And then as you exhale, try to push all the air in that you have out and you feel it in your body. Okay, so if you want to do in for 4, out for 7, in for 4, hold for 7, out for 8, we can do that together. All right, so in, hold, out. Great.
Thank you.
Sure.
For that. And we're going to flip the card. This is a card that we actually use in our program, and it's part of why I put that there. I didn't know I was going to spill my coffee, but I think when we talk about emergencies, when we experience emergencies, when we simulate emergencies, we have to pay attention to the responses it brings up in our body and how that then turns into our actions and our ability and willingness to engage in the work. And so this is a little card. On one side, we have SBAR, which for those of you that don't know it, it's just a framework for giving a report, an organized report in an emergency, where you start with the top line situation. So people have a filter and a frame for the rest of the information they're going to get. And so that they can, start to generate a plan, a collaborative plan, as the patient transitions from one practice to another. So we provide these little tools, an SBAR card with a breathing exercise on the back, because both things are needed for this work to work. We need to be taking care of ourselves and and each other, and we need to be doing the work, doing the real work of what it takes to collaborate and move patients quickly in the case of an emergency. So just an outline of where we're going to go from here. We're going to hear a little bit more about Birth Detroit and Henry Ford Hospital, and also a little bit more about the Step Up Together program. We are not going to belabor, information about what a birth center is or why it's important to transfer patients in emergencies. We're going to assume some level of knowledge about that, but there are also some resources that we will mention that go into more depth. And there are, of course, plenty of resources from Birth Center Week that we hope you're accessing, as well as this webinar today. And then we're going to talk about the Action Collaborative that we completed earlier this year. We have some data from all of the practices and teams that were involved in that. And then we're going to do some deep dive on Team Detroit's experience. We really encourage you to drop questions. And we also have built in some time. And then I'm going to be posing some questions to our panelists as we go, and people might have their own experiences that they want to share with that. Okay, so let's see. Angela, do you want to speak for a little bit about,
Sure.
just share a little more about Birth Detroit?
Yeah, so Birth Detroit is a justice response to evidence, inequity, and community demand. The mission of Birth Detroit is to midwife safe, quality, loving care through pregnancy, birth, and beyond. At Birth Detroit, we vision a world where birth is safe, sacred, loving, and celebrated for everyone. It was founded by 4 of our co-founders, and I'd like to just uplift their names here today: Charlie Snow, Alon Jaffrard, Leslie Welch, and Nicole White. So thank them for their vision. Birth Detroit is a unique nonprofit birth center with a community organizing, multifaceted strategic approach to birth center development. We actually opened our doors and started providing care in the midst of the pandemic, so October of 2021, in response to the community saying, hey, we need you. So we started providing prenatal postpartum care in October of 2020. And we're super, super excited. We will be celebrating our 4th birthday in October, and we will be hosting our ribbon cutting on October 13th. So Birth Center is loading, and we're super excited about that.
Yes. It's been so exciting to see the development, and folks should follow along on social media if needed. Let's see, Dr. Bellamy, you want to share a little bit more background on Henry Ford?
Absolutely. Thank you again. It is certainly my pleasure to be here. Henry Ford Health is located in Metro Detroit urban area, and it is a level 1 trauma center. We have certainly extremely busy ER. It's level 3 NICU. We have an extremely busy NICU because we have an extremely busy labor and delivery setting. So we have 12 LDRs, a couple of ORs, triage, and we have a combination of physician and midwifery services, MFM program, fellows, and the gamut, the spectrum of maternity services. And we have I think we have the largest midwifery service in Michigan, to my knowledge at this time. So we are certainly thrilled about this opportunity to further our relationship with midwives at Birth Detroit. And we are so excited to share with you again our experience working on this project for the safe delivery of care for patients in our community. Thank you so much.
And this is the team that, the full team, we just have a subset, but this was the crew that did the drill that we're going to be talking about. And just to see this collaboration makes me smile. So Step Up Together, a little bit more about this program. This is actually a screenshot from our new website that just launched at stepuptogethernow.com. So hopefully you'll go there, and if the link isn't already in the chat, we can put that in. We have a family of programs that are focused on stepping up safety and teamwork for perinatal care starting in communities. So we really think from the primary maternity care kind of lens about how do you build quality and safety from the community and build toward those higher level of care services. And so we really, immerse ourselves in midwifery models, home birth, birth centers, other community-based care settings. And so you'll find on this website drill kits and other programs and resources for different kinds of drills for emergencies that emerge in the community setting, and where the birthing person and or the newborn needs to be moved across levels of care and across locations of care. And so that's really the sweet spot that we operate in. And we really think a lot about this framework that I've been trying to kind of get people thinking about, of the 3 delays, which is a framework that comes from global health and thinking about places that don't have maternity services at all, and which is unfortunately becoming the reality in a lot of parts of our own country. So thinking about how delays can creep in, which can result in poor outcomes. They can creep in the beginning when there's a lack of a recognition of a problem emerging, or whether that's a patient not acknowledging a symptom, or a first level provider, a midwife, not recognizing a symptom or activating sort of the process to move the patient to a higher level of care. You can also have delays creep in during the transport itself, of mobilizing the patient and getting them to the location they need to be. And you can have delays creep in if the receiving facility is not prepared, or if there's paperwork issues or whatever the case may be. So you want to be thinking about sort of all of these potential delays and different solutions across the spectrum. So we have sort of a family of resources and programs that get at these different delays and that encourage collaboration across all of the different stakeholders. So this all came together with a group of teams that participated in an action collaborative in 2024. So I want to share a little bit about the action collaborative. This really has been part of a series of work that PMC and some other partners have been involved in for a while, starting with some landscape analysis that helped us recognize that there are a lot of resources for birth centers and for people who want to start birth centers, for instance, and so on. But there was really a gap in information for hospital-based people about how to integrate and collaborate with birth centers. So we started by researching and then developing this hospital guide to integrating the freestanding birth center model, and that's available on our website, and that link will be forthcoming in the chat, or we can send that out as well following with the slides. We also offered a learning series to kind of unpack that, and that's available on our website as well. And what we were moving toward is really putting the concepts into action of really what does it look like when the birth center and the hospital, as well as the transport EMS partners, are really working together smoothly and are collaborating, not just around emergencies, but the guide covers, a lot of forms of integration and collaboration that can really be a win-win-win for the birth center, the hospital, and most importantly for the patients and families that seek the services. So all of these materials are freely available because they've all been funded by funders, including the Skyline Foundation and United Healthcare. So just wanted to give them a shout out. And the Purchaser Business Group on Health, which helped us publish and do outreach on the guide materials. So the Step Up Together program includes kind of tools and different levels of support to run drills. And we anticipate having more types of programs that we do, but right now we've been focused on drills for clinical emergencies. And so we have drill kits, and we're going to sort of open up a drill kit and look at what's inside. But those are the clinical scenario and the sort of instructions and materials that you need to actually run an emergency drill. And so if you're like an established practice and just need to run your quarterly drill and don't want to come up with a scenario yourself, you can just download a drill kit. We also have an upcoming focused action cycle. We will talk about that, which combines those drill kits with something that we call a community debrief, where we take groups that have run the drill using the drill kit and debrief their experiences kind of in the round with, so that we can learn from one another and take the lessons learned in one setting and apply them to others, and make sure that we really maximize the cross learning. And then in the action collaborative, which is what we did with the team in Detroit and with 10 other teams around the country, is where we really layer on additional coaching and sort of some intermediate steps toward the ultimate goal, which for each of these is to run a full transfer drill, which is a clinical emergency drill that begins in the birth center or in another community birth setting, moves by emergency transport, and ends in the hospital. So the drill itself, the simulated patient, and all of the staff that are taking care of them actually, physically move, and then a debrief happens at the end of it. So our action collaborative in 2024 was seeking to work with birth centers that had hospitals that they were either already collaborating with or working toward a collaboration with, but bringing the hospital and the birth center together into this program and rolling them as pairs and dyads, and in some cases with their EMS partners as well, into the program itself. And so really strengthening those relationships, tightening up any policies and procedures to help support the planning for transfers, and then conducting, executing, and debriefing a full transfer drill, which again moves and tests the full transfer experience. And then to really help surface the interdisciplinary roles and responsibilities that people can walk away with a better understanding of, and turn improvement opportunities into improvement initiatives so that we can continue to advance the outcomes and quality of care. So this is what we all did together. We started the year together. January 9th, we kicked off. We got folks to the midpoint in March, where we were asking people to do what we were calling then a team drill, and we now refer to as a partial transfer drill, which is just testing part of the overall spectrum. So just the part of the emergency that happens in the birth center, or just the part of the emergency that happens in the hospital. And so that's actually what the teams in Detroit did, because as Angela said, their building is not actually open yet. So they haven't conducted the full transfer drill yet. That's coming later this year. But there's so much learning that can happen just from testing, sort of breaking a drill, a clinical emergency apart into the component sections of that 3 delays framework that I talked about, and really testing the different parts and then bringing it all together and doing, the maximal learning that way. So we had a bunch of teams doing this from January through May of this past year. These were the teams that we had around the country. So we had 11 total. These are the birth centers, and each of them had a hospital that they were enrolled in the program with. And you'll see, you may or may not be familiar with these, but we had a real mix of the level. We've got Birth Detroit, which is not even open yet, and some that have been open for decades. We had different models in terms of whether there were nurse midwives or CPMs or a mix of both. We have a number of BIPOC-led birth centers that are part of the BCE network listed here. And so we really had a nice mix, and also just different types of integration with the hospital and different levels of services available at this hospital. So really what safe transfer looks like is going to be very personalized to these different communities based on what the models are, but there's so much shared learning that needs to happen. So that's where we try to bring the tools, coaching, and community together. So we are going to focus in on the Birth Detroit on this map. And so I want to pitch this out now to the panelists, and we'll hear from each of them on these two questions, and then we have some additional questions. But just thinking, like, before you got involved in this, what has this partnership looked like? What makes you passionate about it? And what were some of the things you were looking for that support from the Action Collaborative as you were preparing to enroll in it?
Okay, thank you, Amy, and thank you for that great overview of the program. And it has really been a pleasure to engage with the Birth Detroit team on this project. Angela and Charlie are amazing, and I've known them for years, and I know they're amazing, and they display it every day as we interacted with this partnership with Birth Detroit. So, I went into this partnership very excited about the potential things that could happen in our community. I've worked in the space of maternal child health for over 30 years, and with my primary goal being to improve maternity care services through efforts in the clinical setting, which is where I work in the hospital setting, but also via advocacy efforts locally, nationally, in any way I can to advocate for the care of birthing people. And I truly believe that every person has the right to have the birth of their dreams. And every person has the right to have a birth that is safe, that is accessible, that is human-centered, and that is overall respectful for what they want as a person, for themselves, as well as their for family. And like you and many of you on the call and on the panel, I am very well aware of the devastating effects of morbidity and mortality on the maternity sector and the crisis that we have in our nation, and the higher impact on Black and Brown persons. So the partnership, what I was so passionate about is the focus on safety and teamwork for perinatal care services. And as a clinical nurse specialist, which is what I have been practicing as for the most of my career since I became a midwife, interesting enough, that's another story. We don't have time for that. But anyway, so my role is focused on education, safety, training, and all of those things. So it really fit well with what I would see. I am a strategic planner. So the program really helped us answer those questions of who, what, when, why, and especially how, because this was a new space for all of us to navigate. So the how to do it is really critical, and that is what the safety is all about. And it also built on communication, staff training, and drill preparation, and that really helped us connect with all of our stakeholders within the hospital and the community as well. So I'm passionate about a lot of things, but it really helped ground us on what was important and how we could move forward in really the design of this relationship. This is, again, it was new for us. So and all of the check marks were met with this program, which is really great. And there was a lot of great learning along the way.
Awesome.
Here at Birth Detroit, one of our core values is safety. So, this partnership helped to uplift that, uplift safety, and it was very important to us to do the work now before we opened our doors so that we can better hold and support our families as the needs arise. And also, one of the things that's important to us here at Birth Detroit is seamless care continuum. So it helped us to work on communication and care coordination between Birth Detroit and Henry Ford Health. And it helped to acknowledge too that the alignment of birth centers with healthcare systems helped to strengthen the maternity care model, right? And enhance the overall public health outcomes. So thank you.
Yes. Tatiana, anything that you wanted to add?
No, I think they both answered that question.
Great. And Jen, I wanted to see, just as one of the faculty that led through this, just reflecting on this question about the Action Collaborative, what were you hoping to gain or see from the participants, and what excited you about Birth Detroit and Henry Ford signing up? We all had a little happy dance when we saw Birth Detroit and Henry Ford sign up, because we've been fans of yours.
Yes. So I'll just say I was very excited when that your team signed up for a lot of reasons. I mean, first of all, I went to school in Ann Arbor. The first midwife I ever met was one of my professors at University of Michigan. And Leslie Welch was actually one of my most memorable undergrad professors. So I was a little starstruck when uh, all these years later in my career, I got to circle back around and be part of such an amazing organization that she's been part of, doing really important work. You know, we know that maternity care culture and maternal child wellness and well person exam care for folks across the country needs a lot of help. And there are so many health disparities based on race and class and where people live, rural versus city. And so getting the chance to work with this specific partnership that was born in an area of the country that means so much to me has been really, really special. Um, and with the Action Collaborative, generally, I mean, Amy and I have been working to build up to this exact type of partnership. You know, the community and the hospital should be really clear allies and working toward not just running drills like this, but seeing each other's unique skills and unique personnel and really coming together to serve their communities. And I've seen from the midwife's perspective what that can look like when it goes really well in my career. And I've seen the challenges that can arise as well. So getting to, you know, get to this point where we're infusing things we've learned along the way into real life partnerships like this and bringing it to the entire country. You know, there's a lot of work to be done, but it's been really, really powerful to be part of the work that we are doing right now. So that all of that has really meant a lot to me.
Awesome. All right, let's keep going. We'll dig in a little more to what was involved in this program and kind of unpack the process. So this program is really about standardizing the transfer process, and that's going to look different in different locations as far as exactly how you initiate and run a transfer. But everybody who is working in these systems should know how it should go and should be able to know where to find the information. And so we really emphasize designing a process that works given, you know, all of the constraints and so on and opportunities in different settings, creating the infrastructure, trainings for teams, written policies, you know, checklists and so on to support that process, and then running the drill so that we can test the process, and then debriefing so that we can take what we learned and turn it into improvement or an improved process, and then keep going around the loop. So we're doing, you know, a QI process. If any of you have done quality improvement work, you've probably seen a circle that goes around like this. But this is really what we're up to in the overall program. And we're really trying to test this process so that it will work when it's real patients. So really creating safe space to see what works and importantly, what doesn't quite work. So the heart of the program is a drill kit, and these are just some screenshots from the drill kits that we used in the Action Collaborative. These are now, versions of these are now available online at the stepuptogethernow.com website. And they're digital and can be sort of configured to the drill that you want to run, whether that is a full transfer drill, or if you are just doing like the birth center part where you're like, I just want to run the scenario as it happens in the birth center, test the, you know, response of the midwives to the hemorrhage or whatever the scenario is, and then we'll just cut it off at when we give report, because it's a lot to coordinate a whole entire drill with, you know, the partner hospital with EMS and whatever, but that is kind of the holy grail. So the drill kits can also be set up. You can download a version of it for a full transfer drill or for the partial transfer drill. But in either case, you get worksheets for the coordinator, who is literally like reading the case as it unfolds. So in a timed manner, saying like, okay, now the patient is bleeding. Okay, now, you know, she's faint, those kinds of things, and giving additional values as the providers are simulating the clinical care and the different assessments that they might do in response to what they're seeing. And then there's also observer worksheets so that people who are observing the drill and as it happens can reflect on, are they seeing what they're expecting to see in terms of the management steps? Are they, you know, activating the protocol as they should, or are they doing it, but maybe later than you would want to see? So it's just like a way to keep some notes so that people can have an effective debrief when they come back together. And so we also offer a debriefing guide with some standard debrief questions and some thoughts for the different clinical scenarios about how to convert that debrief into action items and quality improvement measures, and then documentation. And so we provide an opportunity for people to fill out, the information about the drill. It gives them the documentation of their drill that they might need for like birth center accreditation, for instance. And it also has enabled us to collect a bunch of data from now dozens of drills that have been run using these kits in different settings around the country and see kind of the patterns. And so it's been exciting to work with some of this data, and we're going to look at a little bit of that here. So this is just the data from the Action Collaborative itself. So we had 11 teams at the beginning, none of whom had ever conducted a full transfer drill. And by the end of it, 7 of them had, and several others, including Birth Detroit, have it kind of on their plan for the fall, but weren't able to for different circumstances. So we really were able to move the needle on that in terms of like whether, the ability to pull this off, which is a lot of logistical steps and takes commitments of people's time and energy. But so we were just very excited that so many of the participating teams actually completed the full transfer drill. We also saw that most of them conducted the partial transfer drill in addition to the full transfer drill, and just one hospital, and it was Henry Ford Health, conducted a hospital-based partial transfer drill. So that's where they're starting from, here's what we're getting, patients walking in the door, and the scenario starts from the intake into the hospital. And so they're testing the process of getting the patient admitted and getting the report from the midwife and so on. So we were really excited to see that engagement. We had amazing engagement from the hospital partners in the drills in the full transfer drills and in the sessions that we had, but we would love to see more engagement in running their parts of the drill as well. We saw a lot of participation from EMS as well as the hospitals in the drills themselves. So that was excellent. These are some pictures from the Birth Detroit drill. What scenario did you all do? That you all did the hemorrhage or intrapart? I can't remember which one. Hemorrhage?
Yes, immediate postpartum hemorrhage.
All right. Yeah, do you want to talk a little bit about just what you're seeing here in these images?
So in these images, we had just arrived to the hospital. So I was passing off, and our goal is midwife to midwife transfer. So I called ahead, I called report, and that's myself in the red pants reporting to the midwife that received us at the hospital. The team was there to receive us, the ultrasound was ready, and I was able to stay and support my patient to help her to understand as a familiar face anything that she might not have understood. So we were received with open arms. My patient reported feeling very safe. And it was great.
Yeah, love these photos. And I'll just point out that I'll just take this moment to say we did a hemorrhage thing, and we also had different scenarios that participants could choose from: a newborn scenario, this hemorrhage scenario, or an intrapartum transfer, because you have to really plan the process for each of those, and they can look very different in terms of who's involved and what the specific steps are for the transfer. And we we offer a lot of guidance around how you can incorporate a lot of realness to these drills and a lot of people focus on, getting the mannequins and lots of fake blood and, how do you mix blood and stuff like that. And so some of our teams do incorporate those kinds of things, but you can be really lo-fi with the actual clinical scenario because there's so much to test in the transport process itself. So we saw a lot of people who at the beginning of the process were like, give us more, more complicated clinical emergency. And it's, and what we have found is that there is value in those specific skills of how you respond to a hemorrhage, but there's also, being able to estimate blood loss and quantify blood loss and all of those things. And again, you can layer that on in small ways or larger ways, but we just, it was just something I wanted to mention, that there's what we focus in this program on is really keeping fidelity to the transfer process itself. So if there's certain paperwork that you need to fill out, that's part of getting a transfer into the system in the hospital, then like fill out the paperwork, those kinds of things. So we really try to emphasize those kinds of approaches to fidelity.
Yeah, Amy, I'd love to jump in for a second
Yeah.
and just contribute to that, because, you know, part of the resources we've created is that we at PMC, we are the ones writing these drill scenarios, and then getting them reviewed and putting them out there. And so just to elevate Amy's point, the whole point is to test the process, not necessarily to have 6 emergencies happen back to back to back where you feel like your head is on a swivel. And another piece that I want to point out as well that I think is really important about the program we've created is the observer worksheet. You know, especially when you have a huge team that you're getting together to run either a team drill or a full transfer drill, you know, a partial drill or a full transfer drill, you're going to have a lot of extraneous people that are not inside the drill acting as the patient or the midwife or the physician. And, you know, I don't know about you guys, but I've been in scenarios where there are just so many people watching the drill that people will get really distracted. They talk to their neighbor in the back, and they're only, you know, if they're not in it, they're not really paying attention. And so we've really found a way to bring everybody in and give everybody accountability to what's happening by creating these observer worksheets where the observers sometimes see things and bring them up in the debrief that the folks inside the drill didn't notice. And so everyone is really important, you know, even if it doesn't feel like you are, you are. And so we've really tried to be so inclusive, so that no matter how many people on your team are participating, everyone's voice is really important. So I just wanted to point that out as well.
Yeah, thanks. All right, I went back so we could see what you were talking about. So yeah, so just I would love to pitch it back out to Team Detroit to reflect on this question about just what lessons did you learn from your experience doing the drills and other safety efforts that you've been doing? Any kind of unexpected surprises or things that you feel like would be helpful for others to know about this journey?
Hi, everyone.
Like go ahead, Pati.
You can go ahead, Angie. I'll go after you.
You know, I was just gonna say one of the things that like I hold near and dear to myself personally is the 3 delay framework. I revisit that often. And in the context of the birth center, we're talking 1 to 3% of birth center admissions are usually urgent or emergent transfers. So not a lot of births, but it's important that when that need arises, recognizing the problem and transferring right away, early mobilization, you know, and acknowledging that the other delays can happen along the cascade. So I'm always thinking ahead and, you know, trying to avoid those delays when you see things brewing to act accordingly. And one other thing I'd like to share is EMS. When it comes to transfers and involving EMS, there's many different considerations when it comes to EMS. It's not so simple as calling 911. So exploring that and cultivating and developing those relationships with our local EMS system, you know, we learned a lot, you know, navigating that process.
Yeah, there were so many different approaches to that in the collaborative itself. And even Jen and I were learning things about how EMS and this emergence of blood on rigs in some communities, which is definitely not happening in other communities. It would be interesting to see how that's rolling out. But we really need to know your EMS, what their capabilities are, what their response, you know, what words, you know, how you actually activate the dispatch for facility to facility transport. So yeah, I saw you all really engage around the EMS stuff. And there were a lot of other folks, I think, listening and trying to understand how others have approached that. Tatiana, did you have something that you wanted to?
Yes, I just wanted, I think that it's important for just effective communication among all the interdisciplinary teams. And I think that we went through that pretty extensively with meeting with multiple different teams. First, explaining what we're about, what the transfer is about, what different scenarios would look like, getting an idea of their policy and procedures on a normal standpoint, and then just coming to an agreement to make sure that, our birth center patients are still being heard, they're still being seen, they're still being respected. And although that their situation may have changed where they have to come into the hospital for whatever the reason is, we have different teams in place that they're ready to receive the patient. They're receptive to receiving patients, because I'm sure there's different stories about birth center transfers. So this system is phenomenal in, clearing some of the clearing the air on different hospital transfers, and just having the hospital ready to receive these transfers, and having information, and having, a midwife come with the patient, and having that rapport with midwife to midwife information, so that we have a better understanding of the patient that we're receiving as well.
Yeah, thank you for that.
And Amy, can I just tag on to what Tatiana was sharing about the different services? We were fortunate to involve all of our stakeholders that we only named a few of stakeholders that we thought were involved. To our surprise, there's so many more stakeholders, and what was great about having these interdisciplinary meetings, the stakeholder, if we were meeting with the NICU, for example, they would have a question about, hey, well, do we have the are we covered if we go to the birth center legally? And we were like, well, we're not sure. So that drove us to speak to legal. So as we were meeting with these teams, they were coming up with great questions that that would lead us to then speak to other services to, again, make sure that we were safe in the care, and try to check off all the boxes to make sure that we have all of the questions answered, but also realizing that there are probably going to be some more questions out there, but we're working together as a team and educating in the process to make sure that at the end of the day, there is a safe transfer of a mom or her baby, should that need to happen.
Yeah, thank you for that. Jen, anything that you want to add that you learned from kind of either Detroit's participation or the other teams?
Sure. I mean, I think that, building these partnerships as they've done in Detroit before the birth center is even physically open is the ideal, that really should be the gold standard, when new birth centers or maternity care units are being opened, and building these relationships that you can, have all of these processes in place from the beginning. Of course, we can't go back in time to every birth center that's ever opened or every home birth practice. Of course, we don't want to leave out all of our community settings, but, I think that no matter how long a community practice has been in place, it's never too late to start building these bridges and reaching out to, your local EMS and hospitals, and really vice versa. I think that, there are folks that feel really committed to this care setting that they've worked in their whole career, and kind of can see folks in other care settings as other. But all we really need to do is find our champions to meet on the bridge, and start building from there. And I think that has been a really important lesson from our Action Collaborative. And the key to interdisciplinary safety is interdisciplinary respect and communication.
Awesome. Yeah, and I wanted to lift up a resource that we have on the Step Up Together website that is called a stakeholder planning map. And to the point that you made, there's so many stakeholders, and each of them has important concerns and also like opportunities. There's also like the flip side of that, of there's something maybe that they can gain, whether it's like patient referrals or, you just have to kind of have the conversations to know. So I am going to switch to the next slide. I'm also getting a something from my computer. So if I get lost, Jen, it will be up to you to speak to this. In fact, can you present this so I can try to find a charging cord? And yeah, tell us about the focused action cycle that's coming up.
Of course, yes. So you heard earlier about our Action Collaborative, which Birth Detroit and Henry Ford participated in with the 5-month, program with the 7 sessions. The focused action cycle is really a distilled version of that, where rather than have multiple meetings where we provide, the background and every little bit of information on how to form these relationships and run a full transfer drill. These are for folks who they're ready to run a drill. We all meet together. You choose one of 2 drills that will be published on the website. And then you go out, you run your full transfer drill, and then we come back together for a second session for our community debrief. So again, it's a distilled down version, but just as powerful, where the first meeting is to meet who else is, doing the same thing as you. You run your drill, and then you meet a second time and you debrief and you talk about how it went, what you learned, the challenges. And what we have found is so powerful about these community debriefs are the pearls of knowledge that can be shared across sites that can maybe be the solve they were looking for to a problem they just discovered. And really creating partnerships, not just in any one community between the birth center and home birth and the hospital, but really of folks that are doing the same thing you are, but in another state or another region or what have you. And so just building upon the this really powerful network. And I see we've got the Focused Action Cycle 2024 schedule out on our slides right now. You got it, Amy?
Yeah, so I was like, I switched here. So as you were kind of describing what's involved. So, and I just wanted to emphasize that, again, the tools can be used to run the drill as a full transfer drill, which takes some planning. And like Jen said, it's for people who are like ready to roll, but they can also be used to just dip your toe in, do a partial transfer drill, even do like a mini drill with just a couple of people. So we provide a lot of guidance on the site about how to right size it for the opportunity you have in front of you and to just get started. And we intend to run these quarterly and be rolling out different drill scenarios so that birth centers and other community birth settings that want to run these on a quarterly basis can just access the drill, be part of a collaborative, do the cross learning, and also just not have to reinvent the wheel and come up with the tools themselves. So that's the vision, and we're starting with this and hoping to be able to continue it through 2025 and beyond. But please sign up. I was so excited. I came back from vacation yesterday. We've got over 150 people signed up already, and we are thrilled. I think there's a moment that's happening now where this is becoming something that a lot of hospitals and community birth providers are thinking about. There's an ACOG toolkit coming up. So there's a lot of interest in transfer in general. There's also a lot of other great programs and resources that we collaborate with and try to lift up as much as possible. I want to specifically mention Smooth Transitions, who've done such amazing leadership work in this and who have some tools that we bring in and direct people to. So we will end with this question and then have some time still for additional questions and reflections. But as we mentioned, you all, as you've been preparing to open, have conducted sort of parts of a full transfer, but you're going to have an opportunity soon to run a full transfer drill as part of this focus action cycle I just described, or Jen just described. So would love to hear what you're looking forward to, what you're hoping to kind of learn, or any parts of the process that you feel are going to be most important to test, anything you want to reflect about this upcoming cycle.
I can go first. I think we're all so excited about this next phase because we're going to be able to bring everything together. So it's going to be the events that happen at the birth center, and then with the EMS system and the hospital system. And we have, had those conversations with our stakeholders and we've done the planning. We'll probably do a refresh of everything before the drill. But I think once it all comes together and we have all of those pieces, we will then be able to identify, okay, this is great, but maybe we need to fine tune a couple of other things. The debriefs have been so rich in information, and everyone has been so attentive to the details, which is fantastic. So I look forward to having the full drill that is going to involve all of our stakeholders, because we are committed to getting this right, and we are committed to the safety of our patients and families. So this is going to be actually a wonderful thing to experience. Thank you.
And I just like to say, I'm super excited about having the Step Up team be present for our full transfer drill. Just looking through a different lens and to offer us that constructive criticism and feedback. And I'm super excited so our previous drills have been mom in labor or immediate postpartum, but our focus for the upcoming drill is going to be around babies born. So we'll be involving our NICU team.
Great.
So super excited about that.
Yeah, and I will just add that the Step Up Together team does and can go to the site, and we have some funding that we're grateful for to go to Detroit and run the drill with you all. We did that. There's a story on our website about a rural birth center that we have worked with called Cocoon, and we had an opportunity actually a couple times to go visit them and run drills with them and their neonatal transport team, as well as their EMS. So that is something that we do, but the program is designed for people to use these tools themselves, but we can layer on to a focused action cycle, site visits or individual coaching. And if groups want to come and ask more about the pricing for that, or go together and seek funding for site visits or for full action collaboratives to do the full program with the larger cohort, we're planning for that for next year. But we're really excited, like I said, to just have all these tools. By the end of the year, we'll have 10 drill topics, and all of those will be freely available, as long as we can keep them up to date. So we hope people will use those and then engage in these programs, which we also hope to continue to keep them free for the participants that are in them, and find external funding to support the work that we're doing. So that's any other reflections on what we're all looking forward to? I'm looking forward to coming back. I also share the U of M origin story of how I discovered midwifery. So it is fun to do this for a community that we care about and that we've been keeping an eye on, just out of that interest and connection, and just the amazing team that's connected to this work. Yeah. Other questions? Jen, you want to add?
Much, Amy, everyone. Yeah, I think it would be a great moment to see if there's some questions from folks in the chat. I know we have one hand up from Dr. Julian. I wonder if you'd be willing to type your question into the chat. Or anyone who has a question, please go ahead and type it into the chat, and we'll just take the questions off the chat.
I'm just sharing the, you have to include the word now in our URL. So Julie, you shared a slightly incorrect version of the URL. So
I am so sorry.
That's okay. That. No, it's totally fine, but just, oops, what did I just do? Sorry. I thought I reshared my screen by accident, but we're back. I don't see any questions, but I don't know if I have visibility to any incoming questions.
Yeah. I'm not seeing any questions in the chat yet. I wonder if you have any questions for the audience or anything that you want to ask folks.
Let's see. I am interested in hearing if folks have run drills like this, what stage people are in terms of planning a full transfer drill for the community birth providers that are present. And if there are any particular topics or skills that folks want to see in some of the upcoming drill toolkits that we're developing. So any wish list of materials, resources, would love to hear that as well. And any wishes of for the Birth Detroit and Henry Ford team as they embark on doing this all for real and for their communities. So
I still see here we go. Here's our question regarding Detroit Birth Center. We are looking at an urban American Indian birth center in Minnesota and are looking to visit the sites and meet with staff. I'd love to know if that is a possibility and who to reach out to.
Hi, Rebecca. Great question. I would suggest connecting with us via email. I'll drop an email in the chat, and we would love to host you, do a tour, and talk about that.
Also, just to shout out, tomorrow we have a panel of Indigenous birth leaders. Tomorrow it is at 2 o'clock Eastern, 2 o'clock Eastern. And it's a panel of Indigenous birth center leaders and midwives. And we'd be excited if folks wanted to join tomorrow for that. Other questions? I'm so
And
curious.
I just like to offer too, we have our, our celebration, as I mentioned earlier, on October 13th. So if you happen to be in the area, please come and celebrate with us. You can check out our social media for the flyer and the information there.
We'll take one more breath on possible questions. I think in some ways your presentation was so incredibly clear and thorough that we might be all just be digesting and grateful for it. I know I had one hand raised and I'm just wondering if you might want to drop it in the chat. If not, well, we will then move to close the session, and knowing everyone has stepuptogethernow.com Sasha in your bookmark, so you can follow up with folks, and there's tons of resources on their website. So as you're digesting and looking for resources, it's there. So important to all of us. As I said, birth center equity, one of our core values is safety, and safety is more than just an intention. It's really a practice. And it's really, as you say, the how. So thank you for your attention to that and for your innovation in making sure that we have ways to really focus on safety. So thank you all so much. I'm also going to just drop in the chat right now an evaluation form, and folks will receive that as well by email. But it's just 2 questions. We'd love to know if you learned something new and how this felt for you, and it really helps guide our programming for next year. So with that, I think we will close for today. Thank you everyone who's here, and we look forward to just more and more connections. And you can check out birthcenterweek.org or .com. Either one will take you there. We have lots of events and stories happening all week long. So thank you all so much. And
thank you all. Thank you, Julie, and to the whole BCE team and Birth Center Week volunteers and everyone, and definitely to the panelists. And Jen, glad you could make it too. So really great to see everyone. Take care. Be safe.
Yeah, thanks so much, everyone. Nice to see you all. Excellent work, you guys.
Thank you so much.
Thank you.
Thank you, everyone.
One step ahead of yours, one kiss away from your sweet lips. I know I can't afford to stop for one more moment, 'cause I'm just out of reach of you.